This is an investigative piece that Kwete Nate did for us, and it explains the situation at the Korle Bu Teaching Hospital, COVID-19 patients sharing the same ward with other patients who are not necessarily COVID patients. Here's his report.
Hospital records show that on the 8th of February 2021, doctors were treating a patient suspected to have contracted COVID-19. The patient was also showing symptoms of fever, difficulty in breathing, and coughing. Clinical notes on another patient with suspected case on admission also read, and I quote, SARS-CoV-2 test to be done. Focal person contacted. He reports they have run out of logistics currently to restock as they take samples as soon as possible. End quote. Another patient with similar COVID-19 symptoms was also admitted into the ward on the 9th of February 2021. On the 5th of February 2021, another patient with symptoms such as severe anemia and pneumonia was also admitted in the same ward. Some staff of the maternity block who spoke to Joy News under condition of anonymity said the patients were on oxygen when they were brought in.
Well, some came in on oxygen, but now they're a bit better. Oxygen has been discontinued. So currently, their conditions are not so bad that we say, oh, for this patient are going to use hair. No. But the only problem is we are still waiting for their results.
When Joy News visited the ward, we observed that the VIP ward has been divided into two. Patients with suspected cases of COVID-19 are treated at one wing, while the regular ones are at the other end. The staff described this as extremely risky to the patients.
One side, which is the west, we receive normal cases. In the east is where we have the suspected cases. It is very dangerous. But what can we say?
Hospital staff tell Joy News what's more dangerous is that they use one protective clothing for all clinical inspections. This is because of inadequate PPE at the maternity block.
The PPEs are not enough, so we are trying to manage. We are just trying to manage, but under normal circumstances, as soon as you enter any room, you should discard whatever you are wearing from head to toe. But when you enter one room, you move to another room with the same PPE.
The staff tell Joy News they have started taking COVID-19 medication in order to protect themselves as well as their families from contracting the virus.
I'm already on the medications, some of the medications, and I've started treating my kids as well. The whole family, they are on it.
They confirmed to us that transferring such cases to the maternity ward is because the holding bay for isolation is full.
My concern is, at least, they should make us know if really they are using the floor, maternity set floor, as a holding bay. Well, prepare our minds psychologically. Also, if we need training. Training has to be given to us. Under normal circumstances, those caring for the COVID patients, they all undergo special training. And those of us on the floor, we don't have that training. So how are we going to cater for the patients, even if we have PPEs? It can never be done. So I think we need training to cater well for our patients. They are our patients. For that one, we can never say, yeah, we need to take care of them.
Head of Public Relations at the Korle Bu Teaching Hospital, Mustafa Salifu, has however denied the claims that COVID-19 and non-COVID patients are being kept in the same ward. According to him, their holding bays take one suspected case at a time to prevent the spread of the virus. On claims of inadequate PPEs, Mr. Salifu said the hospital has enough for both staff and patients. Kwete Nate's report for Joy News.
And my colleague Kwete Nate joins us live, on the back of this report that he filed. Kwete, how long ago was this investigation that you did?
Maybe it only last week.
It's interesting that the hospital says that the staff have enough PPEs and denying the claim that COVID-19 patients are sharing the same ward with others who are not COVID-19 patients. The reality on the ground is clearly different from what the PRO wants us to understand.
Definitely, Mama V. So I had the rare opportunity of being in the ward. I saw what happened. So when they are going to do their clinical examination on the patients with suspected COVID cases, they put on one PPE, and it's that same PPE. In fact, I counted 3 patients with suspected COVID cases who were being examined by one staff with the same PPE, and so the staff enters this room wearing the same PPE. Once he or she is done, they move to the next room wearing the same clothing, and it was same for all the 3 suspected cases who were on the ward. After that, the staff discarded it and then went and sent it to the normal patients.
And this ward is not just any kind of ward, it's a special ward. Explain who usually is expected to be there.
There's a ward for pregnant women, nursing mothers, and it's on the 6th floor of the maternity block when you visit Korle Bu.
There was also another worrying revelation where some of the patients said they had started taking COVID medicines or medicines used in caring for COVID patients because of the fear that they may have also contracted it already.
These were actual staff who are at the ward. So what they are doing, and what they told me, is that they started taking COVID-19 medication as well as vitamin C, and some of them have even gone to the extent of giving it to their children because they don't know what would happen, because they are the same people taking care of the suspected cases on the ward as well as the regular patients. And there's an infectious disease, tell me. So when they get home, they make sure that their children don't come to them. They discard of what they are wearing, go and take their bath before they attend to their family. Even that they feel they are not safe. So many of them have bought COVID medication and are taking them as well as vitamin C.
And do they take the COVID tests?
So they tell me that so far none of them have tested positive for COVID.
Well, Kwete, this is absolutely troubling. We will be following up a lot more. What the PRO said to you, definitely not enough, especially when this investigation was just last week. Kwete Nate put this piece together as our latest investigative report. There will be more in the coming hours on the back of that report. Right now,